So now let's proceed to the hearing impairment. So we have here the characteristic of persons with hearing impairment, identification and assessment of children with hearing impairment, and educational placement or sign language alphabet. So characteristic of persons with hearing impairment. So first is the communication. Communication. Individuals with hearing impairments may use various communication methods depending on their preferences and abilities. So this can include spoken language, sign language, such as American Sign Language, or written communication, lip reading, or a combination of this. So it's important to respect and support the individual's preferred mode of communication. So the second one is the hearing devices. So many individuals with hearing impairments use hearing aids, implants, or other assistive listening devices to enhance their ability to hear. These devices help amplify sound or provide direct stimulation to the auditory nerves. And also understanding how these devices work and being mindful of their usage can facilitate effective communication. So the third one is the social interaction. So hearing impairments can impact social interaction and participation. Individuals may face challenges in group conversations, social events, or noisy environments. Promoting inclusive communication environments using visual aids or communication strategies and ensuring clear and direct communication can help facilitate social interaction. So, the fourth one is the educational needs. Students with hearing impairments may have specific educational assistive technology, note taking support, sign language, interpreters, or captioned materials. Individuals' education programs or 504 plans can help address their educational requirements. So, the fifth one is the advocacy. Advocacy plays a crucial role in ensuring the rights and needs of individuals with hearing impairments are recognized and addressed. Advocacy efforts can involve promoting accessible communication, pushing for inclusive policies and practices, and raising awareness about the challenges and abilities of people with hearing impairments. So the sixth one is the accessibility. Accessibility considerations are important for individuals with hearing impairments. This can include providing captioning or transcript for audio and video content, ensuring public spaces are equipped with assistive listening system, and offering visual alerts or vibrating devices for auditory notifications. The seventh one is the identity and culture. Deaf culture and identity are significant aspects of many individuals with hearing impairments. Some individuals may identify as deaf with a capital D, indicating a culture and linguistic affiliation with the deaf community. It's important to respect and acknowledge these identities and cultural experiences. So the last one is emotional and psychological impact. So hearing impairments can have emotional and psychological impacts on individuals. They may experience frustration, isolation, anxiety, or depression due to communication difficulties or stigma. So emotional support, counseling, and access to resources can be valuable in addressing these challenges. Now let's proceed to the identification and assessment of children with hearing impairments. So first, the newborn hearing screening. So many countries have implemented newborn hearing screening programs to identify hearing loss shortly after birth. This involves a simple and non-invasive test such as emissions or auditory brainstem response to assess the baby's hearing sensitivity. So the second one is diagnostic evaluation. If a child feels the newborn hearing screening, or if hearing loss is suspected at a later stage, further diagnostic evaluations are conducted. This may involve more comprehensive hearing tests such as pure tone, speech, speech and tympanometry to assess the degree, type, and configuration of hearing loss. So the third one is the speech and language assessment. So a speech and language assessment is conducted to evaluate the child communication skills and language development. This may involve standardized tests, observation of communication behaviors, and parent or caregiver interviews to gather information about the child's communication abilities and challenges. The fourth one is the medical evaluation. A medical evaluation by an otolaryngologist or ear, nose, and throat. The specialist may be recommended to determine the cause of the hearing loss and to rule out any underlying medical conditions that may require treatment or intervention. So the fifth one is the developmental assessment. A developmental assessment may be conducted to evaluate the child's overall development, including cognitive, motor, and social emotional domains. This helps to understand the impact of hearing loss on the child's overall functioning and to identify any additional developmental needs. So the sixth one is the assistive technology evaluation. An assessment of assistive technology needs such as hearing aids, implants, or other amplification devices may be conducted by an assistive technology specialist. This helps determine the most appropriate amplification or assistive devices to support the child's hearing and communication abilities. So, seventh one is the educational assessment. If the child is of school age, an educational assessment may be conducted to evaluate the child's learning needs and to develop an appropriate educational plan. This may involve assessment of academic skills, functional hearing abilities in the classroom, and considerations for accommodations or specialized educational services. So, the last one is the ongoing monitoring and follow-up. Regular monitoring and follow-up assessments are important to track the child's progress, ensure appropriate intervention, and make any necessary adjustments to support their changing needs over time. So overall, this is important to involve a multidisciplinary team of professionals, include audiologists, speech language pathologists, educators, medical specialists, and parent or caregivers to ensure a comprehensive assessment and to develop an individual's plan for intervention and support based on the child's unique needs. Let's proceed to the last one. So, educational placement for children. So we have here the first one is mainstream inclusive education. So inclusive education, some children who use sign language may attend regular mainstream schools with support services in place. This may involve having a sign language interpreter or a teacher of the deaf present in the classroom to facilitate communications between the child and their hearing peers and teachers. So also we have here the support services. Additional support services such as speech language, therapy, or educational support may be provided to address the child's specific needs and ensure effective communication and academic progress. So let's proceed to the second one, bicultural education. So we have here the first one is the bilingual approach. Bicultural education emphasizes that development of both sign language and the written spoken language used in the surrounding community or English or another spoken language. Instruction is provided in both sign language and the written spoken language to foster language development and literacy skills. So Also, we have here the schools for the deaf. Some regions have specialized schools for deaf or hard or hearing students that follow a bilingual bicultural approach. These schools typically have teachers who are fluent in sign language and provide a supportive environment for deaf students to learn and communicate. So, the third one is the total communication approach. So, total communication approach. The total communication approach involves using a combination of sign language, speech, and other visual aids, such as visual, facial expressions, and gestures. So, to facilitate communication, this approach allows children to use different modes of communication based on their strengths and needs. So, and we have also specialized programs. Specialized programs or school may adapt the total communication approach, providing a comprehensive communication environment where students can use sign language and receive support in spoken language development. So, the last one or the fourth one, deaf schools or specialized programs. So, we have here the residential or day schools. Some children who use sign language may attend specialized school for the deaf, either as day students or in residential settings. These schools provide a fully accessible environment where sign language is the primary mode of communication and specialized instruction is tailored to meet the needs of the deaf students. So, it is important to note that educational placement decisions should be made on an individual basis, taking into consideration the child's specific needs, preferences, and available resources. So, collaborative discussions involving parents or caregivers, educational professionals, and relevant specialists can help determine the most suitable educational placement for a child who uses sign language.